afternoon, and I want to thank everyone for coming on today. We will begin at about 1:01 to let everyone settle in. Before we begin, a bit of housekeeping. I want to let everyone know that we are going to be in listen-only mode. So for the duration of the presentation, we'll be in listen-only mode. All questions will be typed in of the presentation on the right-hand side. You will see a control panel on your right-hand side. Again, that is where the questions will be typed in. In addition, we have included handouts on the right. You can click on and download on your. So we will begin in a couple moments' time. Again, everyone will be in listen mode, and at about 1:01, we will start the presentation. Thank you. I want to let everyone know that before we begin today's presentation, a little housekeeping. The presentation will be in listen-only mode, and at the end of the presentation, listeners will have the opportunity to type in their questions on the right controls panel. On the panel, you'll also find a section that says handouts. We have flyers about our programs in addition to today's presentation in PDF form. So again, we will be in listen-only mode for our presentation. Questions will be taken at the end of the presentation, and questions will be typed in on the right-hand side. We will begin in a moment's time. Thank you. And I want to welcome everyone to Care Connection, our live webinar. Today we have a very special guest speaker. Her name is Marcy Houle. She's an author in Oregon. And today's topic is going to be misunderstanding pain in dementia care. Before we begin today's presentation, I'd like to let everyone know that we will be in listen-only mode, and questions will be taken at the end of the presentation. On the right-hand side, you could type them in the panel, along with handouts that you could download for your convenience. Now we're going to begin today's presentation. Could you please introduce, tell us a little bit about yourself.
Hi. Yes, I am an author and a wildlife biologist from Oregon. And today's webinar will be based from my newest book, The Gift of Caring, which I co-wrote with Dr. Elizabeth Ekstrom, who's one of the nation's leading geriatricians, those very important physicians who specialize in the care of older persons. It's the book I wish I'd had when we went through the experience of Alzheimer's and aging with my family. And most of the information is cutting edge, and it's so helpful to all of us who are not geriatricians or are lucky enough to have a direct access to one. So I'm very happy to be able to share this information with you. So let me start with, I was one who never imagined I would be writing a book such as The Gift of Caring. You see, before my beloved father got sick in his late 70s, I never had a worry in the world about growing old. You see, my parents were doing everything that we read is right. They ate well, they exercised, they had a great social network, and did everything you read about in the news and AARP. And in their 70s, they were still jogging and skiing. And moreover, to be frank, I took comfort knowing that my father played a prominent role in the medical community in Portland, Oregon. He was an orthopedic surgeon. He was a very kind man. He was professor of orthopedics at Oregon Health and Sciences University. He started a wonderful program at the medical school to help disabled children that's still ongoing. And he volunteered his time at nursing homes to, believe it or not, to take care of older persons' feet. He trimmed their toenails. Well, I knew that if something were ever to happen when my parents got older, there would be plenty of doctors and nurses, great hospitals, and services to take care of my parents. After all, wasn't my dad intimately connected with all of those things and the entire medical community? It didn't happen like that, though. I quickly learned the hard way that no matter who you are, when you get sick, when you are old, you become a head in the bed. You need someone who can advocate for you. But to do that, you need to understand how to advocate, when, and why. So today I'm going to tell you a story about my father, George Cottrell, that I wrote about in The Gift of Caring. I think it is one of the most important things to know about dementia and Alzheimer's. It's something that I did not know, and it's something that thousands of people like me don't realize. And that is one of the reasons I wrote this book with Dr. Ekstrom, who is a professor of medicine at Oregon Health and Sciences University, and to get this word out to all of you to help reduce the suffering of millions of people. Well, taking us all by surprise, as it does for most of us who live through a life with a loved one who is stricken, at 79 years old, my dad developed Alzheimer's. It's a diagnosis, of course, no one wants to hear, but we went through it as a family. Eventually, after a few years, we had to move my father to a memory unit for his care when it wasn't safe to have him live at home anymore. And my mom, his major caregiver, was getting completely worn out. But she visited him nearly every day, and I and my family went often. And to be honest, once that we got used to the new routine, it really wasn't too bad, as many of us who go through this part of life discover. My father seemed to enjoy it for the most part, but then came the big step down. My father had a fall, and he broke his hip. I got the news first, and I went to the hospital to be with him. Well, when a person with Alzheimer's must have surgery, as those of you know who have gone through this, it is very hard because they don't understand it or what is happening, and it's very frightening for them. I stayed with my dad overnight, and he had surgery the following morning. Thankfully, He responded better than I expected. He was transferred back to the nursing facility, but no longer could be in the memory care unit. He would now be residing in the skilled nursing unit of the facility he had been living at. This unit, to be honest, was not as nice. It felt more like a nursing home. Well, because it was a nursing home. But we continued to visit him a lot. My mom, his wife of 61 years, visited almost every day, and my dad was such a gentle, loving man. And as his disease progressed, we worked to keep all emotional connections alive as much as possible with him. And it was going as well as can be expected when one day, about 4 months after my father had been put in his new room, things suddenly changed. When we visited, we started finding my dad always shut in his room. Some days, to our alarm, he would not even be dressed. And when I asked about it, the nurses said it was because the aides were afraid of him. Afraid? I remember asking, afraid of what? The aides said that my father was becoming violent. Well, never in 1,000 years would I have dreamed that such a gentle person as my dad could be described as violent. Even at his worst moments with Alzheimer's, my father might have a sudden vocal outburst and then always quickly settle down. I was confounded, and I said I didn't understand. The nurse explained to me that he was trying to hit the aides. I remember crying, hit them? And she said, he tried to hit me too this week. And then she added, to be honest, no one wants to change your dad's diapers or dress him anymore. He takes a swing at us when we put him in his wheelchair. He's always yelling something at us. Well, this was news indeed to me. I told the nurse he's never been like this before, and she came back with a standard response. That's because it's advancing, the nurse said to me. She said patients with dementia often get like this in the later stages. They can become real combative. Well, I'm sure I looked stricken, and she tried soothing me. She said, I know it's hard to accept. And then she said she'd made a special point to get him bathed and shaved and changed that day. And she added words that made me more unhappy. I'll gather a couple of aides to help hold him down. After hearing that news, I returned to my father's room and slumped in the chair next to his bed, feeling very sad. And when I came a few days later, I found him in his room again, unwashed. And I talked again with the nurse, who told me my dad couldn't stand to be washed or transferred to the bathroom. She said at these times he got feisty and really mean to the aides. She added that lately they'd had to call in Fred, the hefty maintenance man, to pick my dad up and put him on the toilet. She said, your dad screams and he fights the whole time. All Fred's trying to do is help. The following week I visited again, bringing my mother. We went straight to my father's room, but he was not there. I was relieved to find him not trapped in his room, and his wheelchair was gone too. So I assumed he was back in the lounge, enjoying the sights from the window. But he was not in the lounge. My mother and I found him in a row, as we called it, among the land of the pink bibs. He was situated near the end of the line with the other demented or weak patients, with a signature pink garment clasped around his neck. His head was bent down towards his lap. His eyes were open, but they weren't focused on anything. His shoulders were slouched over like a rag doll, and his mouth hung open slightly. My mother was deeply alarmed when she found the nurse, and the aide said, oh, it's not a stroke. That's what we thought it was. He's fine. He's just on a new drug. She continued explaining that the doctor had put my dad on what they called the doctor, and they put him on the new drugs, and when he was getting really, really bad and violent to the girls. And she called the drug a mood stabilizer. Well, I told the aide, he looks drugged. And she replied, well, you're right, he is. And as you can see, he's really nice now. He's controllable. My mom was heartsick seeing him this way, and I called my father's doctor, and he reiterated there was not much he could do except prescribe the mood-calming drug. The nurses felt threatened. Whenever they transferred my father to the bathroom, or to and from his wheelchair, or even merely moving him to bathe or shave him, he would bellow and howl. When they wouldn't stop what they were doing, he would beat at the air or at them. Well, though I hated to admit it, perhaps the doctor was right. Perhaps it was the only option if my father was that difficult to manage. What else could they do except use a highly sedating medication to reduce his antagonism? I probably would have given up then and there if not for my husband and children who encouraged me not to give up. Our 2 young daughters who loved their grandfather and who regularly visited him at the nursing home said, "Papa's not like that." "He is now," I said, so discouraged. But then something happened. My husband asked me, "Did you happen to see the paper today?" Of course, I hadn't had time to look at a paper for weeks. But he told me I better read an article that he handed to me. That article changed everything. It was by a Dr. Brumlesmith, a geriatrician and a leading Alzheimer's researcher from Florida State University Medical School. It was about pain in the Alzheimer's patient, about how those with advanced dementia can't communicate if they are feeling it. The article explained that a person suffering from Alzheimer's cannot reply to a healthcare provider who asks, on a scale from 1 to 10, 1 being no pain and 10 the worst pain possible, how would you rank your pain? Dr. Brumlesmith wrote that often the only way these patients can articulate their feelings is by yelling or flailing out of fear and pain. On a wild long shot, I called Florida State Medical School and left a message for Dr. Brumlesmith, never expecting to hear back. But I did. Later that same evening, Dr. Brumlesmith called, and that one long-distance phone call changed all our lives. Dr. Brumlesmith listened to me rattle off the entire story without interrupting, except for 1 or 2 questions. He acknowledged what we were seeing was indeed distressing, but unfortunately terribly common among patients with Alzheimer's disease. He said, "People like your father cannot elucidate their pain, so we must be the detectives and figure it out. Did your father suffer from arthritis?" he asked me. I thought about it and answered yes, that my dad had often complained of back pain and some shoulder pain too, like bursitis. And he wasn't walking anymore after his hip surgery 4 months ago. Dr. Brumlesmith was very clear in his reply to me. He said, "Your father is in pain." Then he asked me, "Do you know what medications he's on?" Well, I had the list and I read it to him, and we noted there was nothing for pain. But I said the nurse and the providers had told me it had been 4 months since his surgery and he didn't need pain meds anymore, and they stopped him. Well, Dr. Brumlesmith said those providers were very wrong. He said that my dad needed help with his pain very much. He expressed that he was very sorry about my father, and he asked if he'd seen his doctor recently. And I told him that his doctor did not make visits to the nursing home, and had recently put him on the mood-altering drug. What happened next, I will always remember. Dr. Brumlesmith asked if I had a pen and paper because he had 3 things he wanted me to do. First, he said, to put my father on a regimen of 1,000 milligrams of Tylenol 3 times a day. He said that should dramatically reduce any combativeness. Second, he said to make sure the doctor discontinued the mood-stabilizing drug at once. He said what my father required was not sedation, but behavior therapy, which meant there needed to be better training for the nurses and the aides on how to deal with patients with Alzheimer's. Dr. Brumlesmith said that my father was afraid of what they were trying to do with him, and he couldn't understand what they were saying. Plus, they were causing him actual pain when they transferred him. He said, "That's a frightening place to be." The third thing Dr. Brumlesmith wanted me to do was to find a new doctor for my dad. He said he needed to be seen by a geriatrician who was familiar with Alzheimer's and would actually visit the nursing home to see patients. He recommended a physician in Portland and said for me to tell him that Dr. Brumlesmith referred me to him. Well, after that phone call, I did the 3 things, all of them. The mood-altering drug was stopped. Tylenol was begun 3 times a day, and doctors were changed. The ramifications were immediate. My father suddenly quit hitting. He stopped yelling when being bathed or moved in and out of bed. And as his pain level diminished, his behavior significantly improved. And in addition to making the drug modifications, the new physician instructed the nursing home aides to respond to my dad in a new fashion. He taught them about the powerful tool of distraction, instructing them not to yank my father out of the room or handle him roughly or confront him straight on. Instead, he told them, Think of how you might parent a toddler who wants to do something you don't want them to. Rather than demanding compliance and staging a battleground, it's far more effective to sidetrack a behavior you don't want. To manage a frightened Alzheimer's patient, the better way is to use kindness and calmness. Never employ force, but draw heavily on diversion. Speak softly, move slowly, and always act in gentleness. With tremendous relief and gratitude, we watched my father transform from limp and unresponsive, glued to the wall or shut in his room, to smiling again, holding his head erect, and moving about. His life had changed, all because a pair of physicians looked at him not as a severely demented old man on a fast track to die, but as a human being. Well, these two doctors became our heroes. And as I mentioned, this story was one of the major reasons I wrote The Gift of Caring for Dr. Ekstrom, who validated everything I had seen. Because what I experienced with my father is something that thousands upon thousands of people with dementia go through. What Dr. Ekstrom writes in the book is critical for people everywhere to know. The problem of pain in patients with dementia is one of the most serious issues facing older people and is too often undiagnosed. Well, why is this, you might ask? The reason is exactly what Dr. Brumel-Smith wrote about in that providential article that made all the difference in improving my dad's quality of life. People with dementia are often no longer able to recognize that they are having pain, nor can they communicate to others that they are in pain. So rather than being able to express their pain, patients with dementia can only perceive that they are distressed. This can lead them to exhibit uncharacteristic behaviors like we saw with my dad, such as hitting, biting, rapid breathing, anxiety, and refusal to bathe or be helped onto the toilet. Because this kind of suffering is not a straightforward presentation, it is often unrecognized for what it is. And even worse, there's a myth among many persons, and I heard it, that people who have Alzheimer's no longer experience pain. That is totally wrong. They do experience pain, sometimes lots of it. Therefore, as I learned, and as Dr. Ekstrom states, reducing the suffering from pain is one of the most important tasks that care partners can do for those who have dementia. Well, fortunately, there are several highly successful strategies that we write about in the book that can be incorporated by those caring for someone with dementia that can significantly reduce pain for people with Alzheimer's and make their lives so much better. Each one of these prescriptives can greatly help prevent misery. They're like the misery I saw with my dad. So to make them easy to recall, I'd like to remember them as the 5 proactive steps to preventing pain. Yes, they take a little effort and time, but they're not hard to do. And the outcome of employing these strategies, like for my dad, can make all the difference in the rest of the life of those you love and are caring for. Step 1, for the proactive steps, occurs early in the course of the disease. While your loved one is still healthy, talk with them to understand if and what kind of pain they may have. Luckily, I remembered with my dad that he had arthritis and bursitis, but many times we don't think about that. And many older adults experience pain from a variety of sources: arthritis, bursitis, headaches, nerve damage, a host of reasons. Discussing this can be a challenge, though, as many older adults are hesitant to complain about pain, so you and their doctor may not know about it or realize how much it bothers them. But it's very important to try and make note of what bothers them and when they can still communicate it. Document this for later, so you're prepared to help them if they ever need your assistance. And also ask questions to find out what medications work for them to help manage their pain. Step 2, be a detective. Step 2 requires that you brush off your powers of observation and put the possibility of pain in the forefront of your mind. If your loved one has dementia, hopefully you have that checklist of their prior pain problems. Keep it always on hand and stay alert. Frequently, talk with them and the staff at their facility about it. For example, If your dad has Alzheimer's and in the past always complained of back pain, but now doesn't, remember to regularly ask him if he has pain. Then watch. Be the detective. Be on the lookout when your dad stands up or tries to lift something. Does he grimace? Does he momentarily flinch? Does he otherwise look uncomfortable? In other words, become an Alzheimer's sleuth and make sure that the staff at his facility are on the lookout for evidence of pain too. The third step is, if you start observing your loved one or care partner's behavior changing, don't forget to think about new sources of pain. As Dr. Ekstrom has often observed, sometimes something as simple as an ill-fitting denture or a mouth ulcer may cause a person with dementia to stop eating and begin spitting out their food, or even start hitting their caregiver who's trying to help them eat. If any of these symptoms are observed, it's a clue they need to have a mouth exam to see if there's a sore or another problem. Similarly, older adults with dementia may develop pain from an ear infection, from constipation, from an ordinary overly full bladder, or a urinary tract infection, which is a very common problem in seniors and that can increase the state of dementia, as well as other types of infections or problems. Again, this is very important and is too often overlooked or ignored because the sufferer can't communicate it. Therefore, it is critical that any time a person with dementia starts exhibiting distressing behaviors, it's imperative he or she have a thorough exam to make certain none of these problems that can cause misery are present. The fourth, if your loved one displays troublesome behaviors and no obvious source of pain can be found, don't stop your investigation. It's easy to think that your loved one with dementia is just being difficult or problematic because of the disease. Many times, though, pain is the source of their discomfort. Sometimes new patients come to see Dr. Ekstrom with their spouse or caregiver, and the caregiver looks exhausted, saying that their loved one can be mean to them at times. She always asks the care partner, when does your loved one act this way? Often they'll say, well, when I try to dress him or take him to the toilet, he starts shouting. He never was like that before. She then looks over the medication list. More often than not, there is nothing for pain. Then she asks, has your loved one ever had arthritis in the past? Oh, yes, they often come back. He had bad arthritis in his back and his hips. That's the reason for his outburst, she will usually reply, is that it hurts him when he's being moved. Then they try Tylenol, and generally there's much improvement and a significant reduction in outbursts. This is why Dr. Ekstrom writes in Gift of Caring, whenever uncharacteristic actions arise, it's always worth a trial of pain medications to see if it may help your loved one. Over-the-counter acetaminophen or Tylenol is the best pain medication to try first, says Dr. Ekstrom, given at a dose of 500 to 1,000 milligrams 3 times a day. This is exactly what Dr. Brumblesmith suggested for my father, and it worked. And at this prescribed amount, acetaminophen has the lowest risk of side effects of any painkiller and works very well for many types of pain. It's important to be aware, though, that pain treatment regimens are different for people suffering dementia. While people of normal mental functioning are generally given pain medications as called PRN, meaning as needed, this doesn't work for those with dementia. Since they don't recognize pain for what it is and cannot express to anyone what they are feeling, they don't know how to ask for pain medication. It's imperative, therefore, that their pain medications be scheduled. In other words, pain relievers for those with dementia need to be given routinely, whether they ask for them or not. If acetaminophen isn't strong enough, however, there are other alternatives to try, Dr. Ekstrom says, such as nerve medications, among others, and talk to your doctor. But be cognizant that all of these drugs, though, carry much higher risks of side effects and should be used only with very careful monitoring. And if your loved one is suffering from pain, there's one more thing to remember. It is extremely important to utilize non-medication methods to help manage their pain levels. Sometimes these will be enough to cure their pain entirely. Dr. Ekstrom discusses 3 techniques that have been shown to lessen pain and should be implemented with any pain treatment. The first one is important. Whether or not your loved one is actively experiencing pain, This helps keep pain from developing. What is it? Daily exercise. Walking, gentle stretching, and strengthening exercises all help in managing pain. Because lack of movement makes our joints stiff and stiffen and increases pain. Older individuals need frequent movement and activity throughout the day to keep their joints lubricated. And as doctors and pain managers know, move it or lose it. We hear that a lot. It's only half the story. The other half is, after it's lost, pain moves in. Most care facilities and senior centers do have excellent activity programs that older adults can greatly benefit from. And the second non-medication method to help manage pain is the use of hot water bottles or heating pads. These can be applied to sore areas and can provide a lot of comfort. But if you do them, be sure to use caution. You need to make sure the patient won't get burned, because the person with dementia won't remember to turn off the heating pad. A third practice that can be incredibly helpful in reducing pain is gentle massage and attention to positioning. And often these simple techniques are overlooked, yet they can give a lot of pain relief and comfort. Repositioning also helps prevent sores from developing. So it's important to always keep in mind that older people who have pain should not spend too much time sitting in a chair or lying in bed. Of all the suffering that goes with dementia, for patients and their families and loved ones, like I saw, pain is the one all too often is unrecognized and it's ignored. Yet pain is one of the most common reasons people with dementia become distressed. And as geriatricians know, pain is often the primary reason patients begin exhibiting uncharacteristic and disturbing behaviors. If more people became aware of this, millions of people could have their suffering that they can't communicate relieved. By understanding this problem and paying careful attention to the possibility of pain and providing the judicious use of the safest possible pain medications, this type of misery can be greatly reduced. This is the word I want to get out to all of you and spread it far and wide, because as I saw with my own eyes how different it was when it was managed differently. So please remember the 5 proactive steps to help prevent the serious problem of pain in loved ones with dementia. First, while they are still healthy, talk with them to try to understand the kinds of pain they may have. Second, be observant. Be a pain detective. The third, always consider there may be new sources of pain and get a thorough exam. Fourth, if your loved one begins exhibiting distressing behaviors, it's always worth a trial of Tylenol to see if pain might be the problem. And 5, use non-medication methods to help manage pain levels. Exercise, hot water bottles, gentle massage, and attention to positioning. I adored my father. We all did. And after going through this difficult time with my beloved dad and learning there was something I could do to make his life better and more meaningful and loving, made the experience of Alzheimer's, though hard, so much better. We were able to help him. We were able to reduce the suffering he was going through, but could not tell anyone. That is why, to me, this is one of the most important things to be aware of when a loved one comes down with dementia. Because, as Dr. Ekstrom states, often the results of treatment of pain can be just as positive and successful as those my father experienced. It is the gift of caring. Thank you.
Thank you, Marcy, for that wonderful presentation. I want to let everyone know that we are now going to be questions and comments. And again, we will be in listen-only mode. However, as participants, you could type in your questions on the right-hand side. Again, you could type in your questions on the right-hand side. So I have a question from Jennifer. Her question is, when first diagnosed, how do you make changes so you don't get upset with the person who is diagnosed?
You mean with to say that again, to speak that a little clearer, she's asking about when you get diagnosed, how do you not make the person who has the diagnosis upset? Is that what she means?
Yeah, I think that's what she means. I think what she means is when the person is first diagnosed, how do you make changes? How does the care partner make changes so they don't get upset maybe with the changes the person's going through? Maybe you could speak upon when your father was first diagnosed, how maybe you shifted your strategies and maybe your communication style. Perhaps that's what she's looking for.
Right. I think, and I write about that a lot in the book, because the book, of course, is our story as a family, interspersed with every 2 chapters, What I Wish I'd Known. And those are by Dr. Ekstrom, that gives the real cutting-edge medical knowledge that if I only known that. So as I was going through it, like many of us, I was going through it in the dark. And I think for many of us, too, I was in denial for quite a while. And interestingly, in the book, we talk about this. Even his doctor, who was his friend, was in denial and didn't diagnose it till after it was quite evident. And when asked about that, he said, I couldn't do it because I love George. So I think the denial makes it hard to start making changes, and so you kind of make them on the run. And that's why I think this book would be helpful, because once you do and accept that there is Alzheimer's, then you can start thinking of these things. And there are a lot of ways about how you can communicate with that emotional intelligence that we talk about in the book. And this pain was just one segment of something I thought was very important. But I think, as I mentioned, it's just very important to be aware when you start seeing someone with that diagnosis, what bothers them, what triggers pain, a pain response, and make note of those things. And that will be a beginning. And then caregiving is hard work. We talk a lot about that in the book too. But I think just being aware that pain down the line can be a big problem that most people aren't aware of is something just keep in your mind from the beginning.
Thank you, Marcy, for that wonderful answer. We have another question from Bonnie. And her question is, how do you advocate for pain management when the person living with this disease denies pain to the doctor or dentist?
Mm-hmm. I think that's where it's important that you, hopefully the care partner, will have good communication with their doctor, the sufferer's doctor. I think one thing that I've seen works, I think, in Dr. Ekstrom's clinic, I think this is a beautiful idea. She has the care partner write in their questions before even the visit. So she can be aware of the concerns. It doesn't have to be brought up at the appointment, to the embarrassment or the denial of the patient. So she has an awareness of maybe, I remember doing this for my dad too, or actually my mom, saying she was worried about this or this seemed to cause pain. And then the doctor can bring it up and help. And so I think if you can become a team with your healthcare provider, that can really, really help. Because it's true, a lot of times they don't know what's causing pain, and they can, it can be difficult. But that's where I think being observant and knowing there is treatment, and just, the Tylenol made such a huge difference in my dad's life. But having that open communication with the doctor is so important.
Communication is very important, and sometimes when the person might not be able to utilize their words anymore, you could tell if someone's in pain by maybe how they're holding certain body parts, how there's a change in the mood or the behavior, and things of that nature. And that's a conversation that we could have with our physicians. What are some of the signs if someone's not able to tell us anymore with their words? What is their body language, and how will the body language change, or their change in their eating or drinking habits? So like Marcy was saying, it's important for us always to remain aware and see these changes and be detectives. So I love that, Marcy. Cheryl wants to thank you for your wonderful presentation. She happens to work privately with seniors in the home, and she has a suggestion that she would like to share with everyone. She says, the first thing I do when I greet my seniors, ask how they are feeling and do a quick check to make sure they are not grimacing when they walk with me or using the activities equipment. For example, I use a portable exercise bike, and while timing my person, I take note of his or her movement, and if there is any slight hesitation, I will address this not only with the individual, but their care partner. Pain management is so important, especially when there is an undiagnosed or undetected UTI. Thanks again for the excellent webinar and PowerPoint materials. Thank you, Cheryl, for sharing those recommendations as well.
Those are wonderful recommendations. And I think the more people that have that awareness and can do like the observational techniques she's using, just think of all the pain that could be, the misery that could be reduced. It's just amazing.
Exactly. I want to take this time as we're waiting for other questions to trickle in to let everyone know that this PowerPoint is under handouts in the PDF format. We also have here at the Foundation some new caregiver support groups. We have one starting in October. It's a 4-week psychoeducational group for women care partners. Also, I facilitate a support group every Wednesday, and that is for individuals who are in relationship to someone with young onset, and that's before the age of 65. I want to also let everyone know we are having a special Care Connection webinar on the 22nd on fall prevention. So if anyone who has dialed in today is interested, please register for the September 22nd special Care Connection on fall prevention. In addition, I want to let everyone know that here at the Foundation, we're celebrating our 15th anniversary and we're touring America. So if any of you live in the following areas, we would love to see you at our conference. September 20th, we'll be in Durham, North Carolina at the Sheraton Imperial Hotel. September 26th, we'll be in Long Island, New York at the Melville Marriott. October 10th, we'll be in Indianapolis, Indiana. October 19th, we'll be in Chicago, and on October 26th, we'll be in Boston, and that flyer is on under handouts. And again, these handouts are on the right-hand side for all of you to download and keep as a resource. I do have a question from Beth. Any suggestions for someone with Alzheimer's who had behavioral issues and she has severe primary progressive aphasia? So the lack of communication is even more severe. But it is difficult to differentiate what behaviors are the result of the aphasia versus dementia.
Wow. And that's hard because they do kind of go hand in hand. And I think that's where realizing communication is going to change as the disease progresses and ways you communicate. And I talk about in the book, too, about ways as my dad couldn't communicate and he started losing those skills. How could we reach him? And I think there's emotional ways that you can. Music was a big one, because sometimes that part of your memory is the last to go. And you may not be able to have a conversation like you used to, but you can provide that emotional loving support that they need, and it's something really that you can do. And I know, looking back, now that my dad's gone, I'm so glad that I would say we were able to do the things we did. I think touch is important. Give them things that are, touch them gently, let them know they're loved. All those things are being a detective. Again, some of it's trial and error, and some of it's exhausting, and it's hard, and it's sad. But the things you're going to do make a big difference, and realize you're not alone. Reach out and get help from other people who are going through these things, so maybe what works for them. And the Alzheimer's Foundation of America has these wonderful resources too. And just recognize, again, you're not alone. That's one thing this book really shows, that there's ways we can reach out and help one another. And we do need help, but that lack of communication is a hard one. It's a very hard one.
I would also recommend getting in touch with a speech-language pathologist and perhaps reviewing, implementing like a communication board or different strategies or alternative ways of communicating such as a point and direct with communication boards. So that's something perhaps a speech-language pathologist could work with you. And Beth and others who have other questions, we could also speak to you on our helpline. And our helpline is available Monday through Friday, 9 a.m. to 9 p.m. Eastern Time, and on Saturday from 9 a.m. to 1 p.m. Eastern Time at 866-232 866-232-8484. I see, Beth, that you said you refuse to use any type of communication system. Again, perhaps you would want to maybe refer to a speech-language pathologist that might be able to work individually to meet those individual needs. And I encourage you to call our helpline, and we'd be happy to speak to you privately. Thank you, Beth. I have another question. Hold on one second. I have a question from Jennifer. I meant when asked earlier, how do you not get when when you try to have a normal conversation and they keep making you repeat it because they don't understand what you're saying or don't hear the question clearly that you repeat it over and over again? He has hearing aids and usually does hear what I ask or discuss with him, but now since this was diagnosed, he doesn't want to admit it. He has fallen out of bed numerous times and now has a hospital bed with reels. Do you have any suggestions for Jennifer?
Gosh, I think that extraordinary patience you have to have and realize as the disease progresses, communication is going to take a different form. That they really, they're going to ask, if you give them the questions, almost like give them options. Do you like A or B? And they can pick something simple. But if you have a more difficult, complex question, that's going to be harder and harder for them to answer. At the same time, recognize that you may be repeating things over and over and over because they can't remember, and that's okay. And it's very hard to always keep your patience in this, but I think recognizing that is part of what we go through when someone we love has Alzheimer's, that it's a different form of communication we have to do. And it's hard, and they're frustrated too. It's I think also trying to keep them from getting frustrated. Because, if they have to ask the same question, they get frustrated too. But make things more simple, make things more direct so they can feel they're successful in some regard, and you can feel you've kept your patience in check. And it's not easy, but there are other methods of communication that will come into play as we lose some of the more direct ways we talk. And that's part of the loss. That's part of the sadness, is that you can't have the same kinds of conversations. But I'll say, but you can still provide the love and the care and the support in different ways. And that's very meaningful.
All right, Jennifer, I hope that answers your question. And again, for any of you who have further questions, we would be happy to speak with you on our helpline. We do have licensed social workers, and we could speak to you one-on-one about your questions and concerns regarding family or friends. Again, the number is 866-232-8484. We're here for you and those who you assist. We do have a question, and I'll take a stab at this. Catherine's asking, is there a fine line between dementia and Alzheimer's? What should I look for to determine the difference? Well, just on a brief note, Catherine, dementia is not the disease itself. It's rather a group of symptoms. Symptoms could look like changes in memory, changes in mood and behavior, changes in ability to process information and go along one's daily day. So again, the disease itself, it's an umbrella term to describe a group of symptoms. Alzheimer's is the disease. And so when we're looking to see if someone has this disease, there are some telltale signs like the short-term memory loss, the immediate confusion and immediate orientation, the time, place, and perhaps what they're doing, and things of that nature. And we would be happy to discuss other questions you might have on our helpline. Thank you, Catherine. While we're waiting for other questions to trickle in, I do want to encourage everyone to dial back in next month on October 12th, again from 1 to 2 p.m. Eastern Time. We'll have a guest speaker. Her name is Alice Tang, and she's a loan officer at U.S. Mortgage Corporation, and her topic is going to be understanding the benefits of reverse mortgages. Again, that will be on October 12th, 2017, from 1 to 2 p.m. Eastern Time. At this time, does anyone else have any questions that they'd like to have Marcy or myself answer?
You know, Heather, I think one thing, thinking back on some of the questions, what someone can do when that initial diagnosis comes is very difficult. But one thing that we have found, and again, we talk about it in the gift of caring, is when that happens, to encourage someone, when they still can, to write down their story. And my dad ended up doing this. And write down who they are and their memories. It gives them something to do. It gives the family a gift from them, and it gives them something you can read back to them to try to protect the whole person that's been kind of locked inside them. And so I do encourage that have them work on writing the story of their life. My dad, I discovered, talk about this story, something called the Airplane Diaries. I never knew he'd written this book, and he had dementia at this time, but he was writing his memoir. And I came up and I said, Dad, did you write this? And he didn't remember it. But I could read it to him. And when I was at the memory care facility, that gave me something to do. Sometimes it's hard to know what you do when you come and visit. Well, I'd read him his story back to him. He got excited, and in general, a lot of the men who were also in the facility thought it was their story too. So it worked in a beautiful way until my dad got worse, was in the nursing home part. But when he was in the memory care facility and he still could listen, he really enjoyed hearing his own story right back to him.
Thank you. We have a question again from Jennifer. Her question is, are there tools that help with the individuals get through an average day? I'm not too sure what she means by tools. Marcy, do you know what she's asking for?
I wonder if she's talking about how a caregiver manages, the care partner, how do they have the energy and the stamina and the will to go through this? Or if she's talking about...
Yeah, strategies. So Jennifer, there's many different strategies that a care partner could utilize, and I think first and foremost that's individualized to the person they're caring for. So, you know, for the purpose of this webinar, it might not be the best platform to go over all of the individual tools. I encourage you to call our helpline, and one of the social workers could speak to you privately to know what the situation is and how more on a one-to-one individualized way we could provide you with some suggestions. Perhaps, Marcy, though, on a more general note, do you have any suggestions in terms of strategies, major strategies that help the person through an average day, maybe some things that you did with your father?
Well, one thing, when we would visit him, and actually we even did this in the nursing home, because sometimes it was like, as you say, what do you do? And I tried to think back on things that he enjoyed. And one thing he always enjoyed were parties. And so when we were at the nursing home thing, we asked if we could have a room. And so we made family little celebrations, and it didn't really matter what it was. One was an anniversary or a birthday or whatever. And we'd bring, my dad always used to love his champagne, and of course with Alzheimer's you can't have that, but we got little plastic fluted glasses and filled them up with sparkling cider. And we came as a family on a birthday or whatever, and whether he knew what he was experiencing or not, it was a joyful time, and it gave us something to do. Another thing I would remember was they had a little chapel in this nursing home, and I don't think my dad really knew what was going on, but it was very quiet and it was very peaceful. It was lit with candles, and he calmed down when he went there, and he would kind of go to sleep. But it was little things you try to find what may work. Another one was, in the nursing home, there was a piano. And as they say, music can really, really reach deep into the heart, even when you can't communicate other ways. And so sometimes my daughters would play tunes on the piano, and it didn't matter. My dad might belt out with, "I've been working on the railroad," was not what they were playing, but he found some enjoyment. So it was trying to find those little ways, as you say, individually, that might trigger a response, a depth in them that's still reachable. And those are the times that I think as a caregiver, they help feed us. You know, it's hard work, but you're replenished when you see that you are providing some meaning and care and love in your loved one's life.
Thank you. That was a really great explanation, and thank you for sharing. You know, I think it's really important when the person you were touching before you answered that question, Marcy, about the importance of hearing what they want and what they don't want, what they want their care partners to know about them, what type of care they want, what might they shy away from, and you know, including them as much as possible for as long as possible in the ability to tell us their preferences and their desires. And I love that suggestion of getting their story and documenting that and sharing it not only amongst the family members, but if it comes time for the person to into a setting, to share that with all the professionals that help that person. Mm-hmm. And just recognizing pain is something that as care partners and professionals we should always be on the lookout, like Marcy said, and be detectives and let the appropriate team members know, and so we could help accordingly in a timely fashion. We do have a couple more moments left in today's presentation. Does anyone else have any questions or any strategies that they'd like to share that I could read aloud to others? We don't only take questions, we also take suggestions or tips that have helped you as a care partner or professional helping the person living with this disease. While we're waiting, would you kindly let everyone know again, because I've typed in a couple of times the title of your book and where to find it, because we have a lot of interest. I think we're going to have a lot of readers of your book after today's presentation.
Sure. It's called The Gift of Caring, and the subtitle is Saving Our Parents and Ourselves from the Perils of Modern Healthcare. And it is written by Dr. Elizabeth Ekstrom, who is a geriatrician, and then myself, Marcy Houle. And you can find it on Amazon or all your bookstores. It's available. And it's been a wonderful outreach because people are giving this to their doctors. And the other thing, talking about stories, like from this book, they've actually even made a class at Oregon Health Sciences University, the medical school, using the stories from this book to teach geriatric principles to medical students, working with nursing students, working with social work students, working with nutrition students, all working together. Because as we know, when you get older, it's not just a one-shot deal. You really need the help of all the professionals working together to make quality of life better for all of us.
So Beth is asking, is this book audible?
Yes, there's audio version. Mm-hmm. Mm-hmm.
And where would you find the audio version of your book?
Well, once again, I always say check your libraries too, because lots of libraries have copies of this. And big supporter of libraries. Again, you can get it. You can order it. It's on Amazon, the audio and the hard copy too. So it's available. And just remember, Gift of Caring. And yes, the libraries are a great way to start too.
Okay, thank you. And I know everyone's probably going to be running out and getting your book. It is a great read, so I encourage everyone to check it out. Again, we do have a couple of moments left. Does anyone have any other questions? Or Marcy, do you have some words of wisdom that you want to pass along to us in the last couple of moments of today's presentation?
Maybe I'll just end it saying, you know, why would I title this The Gift of Caring? Because when both of my parents passed away, and it's the story of our family, interspersed with the medical knowledge you need to know, you realize what you've done is worth it. You don't always feel like it when you're the care partner and you're going through these things. It can be tiring and exhausting and frustrating. That's why to have places like your Alzheimer's Foundation to reach out for help, get that help. Take care of yourself. That's terribly important. The caregiver needs to take care of him and herself. But also realize what you're doing is a right and good thing, and you'll be glad you did later. It shows we care, and we're all connected. We're all in this together. We're all going to get older, one way or another, and people have suffering. And to be able, what I found, to be able to reduce some of that suffering, the words we're getting back from people who've read this book and making changes, it's so heartening to me to see that.
Thank you for sharing that. And again, I thank everyone for joining today. We do have another question. Is the audiobook question, is it available in audible.com?
I'm not sure. There's just the audio version, but I would look on the internet and see if that's if it's that way, or call the publisher, or call your library.
Okay. Let's see. Is the book available on ebook?
Yes. Mm-hmm.
Okay, and we have one more question. Great point on taking care of yourself. I find seeking the help of a CBT, cognitive behavioral therapist, has been extremely helpful for me in making the needed adjustments, I think, to handle my mom. So Catherine was sharing how the importance of caring for yourself as a care partner and seeking support for her CBT has helped her adjust to her mom's disease. And again, we'd be happy to speak to anyone who listened in today, and speaking privately on our helpline. We have licensed social workers that are here to help maybe find support groups, or connect with individualized counselors, or even licensed social workers to process what you're going through. Again, it's so important to find those networks of care to get through this, and recognize that there is a great deal of help out there, and it's just tapping into it in a way that feels comfortable for each and every one of us, just like Marcy did for the care for her father. Okay, on that note, we will be ending today's presentation. Again, thank you so much, Marcy. You did an excellent presentation. I thank everyone for taking time out of their busy schedules to dial in today. Your questions were fabulous. And those who have, or rather for those who had questions more on a personalized note, or questions about how to group or about their care partners, call our helpline. We're available today and Monday through Friday, 9 a.m. to 9 p.m. Eastern Time, and on Saturday from 9 a.m. to 1 p.m. Eastern Time at 866-232-8484, 866-232-8484. Again, we appreciate your questions, and some of those questions will be best matched by calling our helpline. I hope everyone has a great day and a great weekend. And again, thank you, Marcy, for the wonderful presentation.
Thank you for allowing me to share it.
Great. Goodbye, everyone.